Hello everyone. I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the topic therapeutic currents, which comes under the course of electrotherapy. So in therapeutic currents, in this video, we mainly concentrate on the topic medium frequency current. So what is medium frequency current? So medium frequency current is nothing but the frequency range of current which lies between the 1000 Hz to 10,000 Hz. So the lower skin resistance compared to the low frequency current. It also shows the more comfortable to the patients. Mainly used for the pain relief and muscle stimulation and also used in the edema reduction. Example for the medium frequency current are interferential therapy, which is IFC, and Russian current. So these two are the medium frequency currents. Now we're going to see about the interferential therapy. So the interferential therapy or the interferential current used by two medium frequency currents that intersect in the tissues. The interferent produces the low frequency therapeutic current. The common carrier frequency is the 4000 hertz. The advantages of the interferential current is which gives the deeper penetration in the therapeutic effect. It also shows the less discomfort and also effective in the pain relief. Now we're going to see about the types of interferential current. So based on the electrode arrangement, the interferential current is divided into four different types. So they are two-pole interferential current, four-pole interferential current, classical interferential current, and the vector interferential current. The two-pole interferential current is uses of two electrodes. The current is pre-modulated. The medium frequency carrier current is modulated inside the machine. The frequencies used are the in Russian current. The frequency used here is 2000 Hz. Whereas in the medium frequency current, the frequency used for 4000 Hz. The main uses of the two-pole interferential current is muscle strengthening, pain relief, and the easier electrode replacement. Whereas we're going to see about the Russian current. So the Russian current have the frequency range of 2000 Hz. There are two different types of this kind of two-pole interferential current is also a type of Russian currents where here the frequency range is used in the burst modulated medium frequency current. The indications have been used for the Russian current are muscle re-education, muscle strengthening, and disuse atrophy. So these kind of indications mainly seen in the sports rehabilitation protocols. Here in these kind of protocols, the Russian current is the one of the major choice for the treating purposes. The advantages of the Russian current are produces the strong muscle contraction, which are most commonly used in the sports rehabilitation conditions. Next, we're going to see about the four-pole interferential current, which is also a classical method. By using the four electrodes, the two separate currents intersect at the right angle. The carrier frequency is the 4000 Hz, whereas in the other electrodes gives more than 4000 or else less than the 4000. Here, the difference between the carrier frequency and also the other frequency, the difference shows the beat frequency effect. So here, for example, 4000 kilohertz, 4000 hertz and the 4100 hertz, which gives the 100 hertz effect. Here, these 100 hertz is denoted as the beat frequency. The advantages of the four-pole interferential current are greater depth of penetration, more effective pain relief. Four-pole interferential current, which is also given in the method of treatment called Victor method. The modification of the classical four-pole interferential therapy, where the interference field rotates automatically, covers a large treatment area. Benefits of these four-pole interferential current is uniform stimulation, better pain control, less chance of missing the painful area. Comparison of the two-pole versus the four-pole interferential current are the two-pole interferential current have been used in the two electrodes, whereas the four-pole interferential current is used by the four electrodes. So here These four electrodes, which is being used in the crisscross pattern, whereas in the two-pole interferential current, which relatively shows the less effect, making it for suitable for the small treating smaller and the more superficial areas. Whereas for the deeper penetration, we going to use the four-pole interferential therapy, which gives the greater depth of penetration and also allowing the effective treatment for the deeper tissues. So two-pole interferential therapy is shows the more comfortable, whereas the four-pole interferential current gives treat the large area. The summary and the clinical importance of the medium frequency currents are the comfortable and the effective. Two-pole interferential current is simple, superficial muscle work, whereas the four-pole interferential current is deeper penetration, pain relief. Russian current, which is the best for the muscle strengthening, widely used in the orthopedic and the neurological rehabilitation. So see you on next video. Thank you.